Dr. Pillay, North Lincolnshire CCG IT Lead, GP Riverside Surgery. In this video, we are going to learn about how to do deferred care. Now, I appreciate every practice and every GP has a different workflow. This is just yet another way of using a template as a tool to help us with deferred care. So you've got the patient in question up and running, you're in consultation mode, you're going to run template, find the One Remote COVID-19 version 5 template. When the template loads, on your left side you've got pages. Now, first thing to say is this template is always loaded with patient identity verified and telephone triage encounter boxes ticked. So if you want to untick it, if it doesn't apply, then by all means do, and you will not find an entry in the patient's notes with regards to these two fields. Come down to risk shielding and deferred care. If you scroll all the way down to where it actually states deferred and delayed care, hot tip number 1, please take some time to actually read what it's trying to say. The second most important thing here is tick the box below to include the patient in deferred care search. So let's just say in this case, I've seen this patient, I want this patient to be referred to the pain team. The first thing I'm going to do is I'm going to tick this box over here and I'm going to say non-urgent pain team referral. And you've got a few options over here, which is pretty self-explanatory as to what you can defer. So, referral for further care in this situation, I'm going to say to pain team over there. I'm going to create a diary date. You can choose this diary date as to how you feel appropriate. I'm just going to put it for about a month in advance. And at this stage, all I'm going to do is I'm going to save the template. Now, what you can see is in that first box which you've ticked saying provision of advice, assessment of treatment limited due to COVID-19 pandemic, that was the text that I had put down, non-urgent pain team referral. The second box where it was a follow-up, that was a diary date, referral for further care, and that is when I put down a sort of a mental note as to when I would ideally like that to happen, and in this case I've just chosen the 1st of June. At this stage I'm going to press save. And that's what it looks like finalized in the body of text. If you now go into the patient's diary date, you will see that a diary has been updated to create an entry for referral for further care. If you go into care history, you will see what coding has taken place. Now, where this actually is beneficial is if you are trying to create a centralized list where either you, the doctor, or your GP can refer to see which patients you've deferred for further care, investigations, immunisations. All you would do is you would go into your EMIS bubble over there, under reporting, population reporting. What you would do is you would find the primary care IT subfolder, go into COVID-19, press run, and at this stage just tick yes. And it's telling you that currently we've got 6 patients in the list. I'm going to right click that and I'm going to press view results. And now what you've got is a report with the patient's details. And this is the bit which helps. It tells you the date where you have actually deferred the patient's care, the name of the user, and what's actually been deferred. Now you can choose to export this, print it out. The other nifty thing about this is you can set this report to run on a weekly basis. If you scroll over the report, right click, go down to properties, under schedule, recurrent pattern, daily, weekly, monthly, weekly over there. I would like it to run every week on a Monday. And I can set an end date, so I'm hoping that the restrictions for referral might end maybe in July, let's say. I'm going to tick OK there. And now what you will see is a schedule sort of clock icon appear on the side over there, and that will run the search for you automatically every week on that Monday.